Hello, everyone, and welcome to today's webinar on replenishing the well, compassion, fatigue, and burnout during COVID-19. Next slide, please. Next slide, please. This webinar is sponsored by the Northeast and Caribbean Mental Health Technology Transfer Center, or MHTTC, housed at Rutgers School of Health Professions in the Department of Psychiatric Rehabilitation and Counseling Professions. My name is Kati, and I'm the project coordinator of the center and will be facilitating the webinar today. The MHTTC is funded by SAMHSA, the Substance Abuse and Mental Health Services Administration, to enhance the capacity of the behavioral health and other related workforces to deliver evidence-based and empirically supported practices to individuals with mental illnesses. Please visit the MHTTC network website for additional information at mhttcnetwork.org. And if you're interested in staying up to date with the events and products the Northeast and Caribbean MHTTC is providing, please sign up to receive our email communications. You can sign up at the bit.ly link provided on the screen. Next slide, please. Following the webinar, you'll be asked to complete a brief survey. We value this feedback and use it to improve our activities and inform future activities. The surveys are also important because our continued funding is linked to the completion of these surveys. So we thank you in advance for your feedback. Next slide, please. We also want to let you know that this webinar is being recorded and will be posted to our website along with the PowerPoint slides in the next couple of days. Next slide. Oh, we encourage you to interact with our presenters during the webinar by using the chat feature. Please post any comments or questions you have in the chat, and I will collect your questions as we go and ask them of the presenter during the Q&A time towards the end of the presentation. During the webinar, our presenter may pose questions to you, so please use the chat feature to answer these questions. This presentation was prepared for the MHTTC network under a cooperative agreement from the Substance Abuse and Mental Health Services Administration. All material appearing in this presentation, except that taken directly from copyrighted sources, is in the public domain and may be reproduced or copied without permission from SAMHSA or the authors. Citation of the source is appreciated. Do not reproduce or distribute this presentation for a fee without specific written authorization from the Northeast and Caribbean MHTTC. The opinions expressed herein are the views of the presenters and do not reflect the official position of the Department of Health and Human Services or SAMHSA. No official support or endorsement of DHHS, SAMHSA for the opinions described in this presentation is intended or should be inferred. Now let's begin our webinar. We have PJ Wenger and Ken Kinter with us today. PJ is our Center School Mental Health Lead and Senior Training and Consultation Specialist. She has over 29 years of experience working in the field of mental health and has spent considerable time in a variety of settings developing her counseling experience. These settings include psychiatric emergency and patient treatment with both adults and children, and home counseling for mental health issues, residential treatment, schools, and private practice. In the school setting, PJ has worked at the elementary level, the middle school level, and the high school level. In addition to this experience, PJ has been a trauma responder at the local, state, and national level. She has responded to large events like 9/11 and Hurricane Sandy, as well as traumatic events that affect schools such as suicides, traumatic deaths of staff and students, as well as homicides. PJ is licensed by the New Jersey State Board of Family and Health Practitioners and is a certified member of the National Board of Certified Counselors. She has a master's in counseling and an EDS in marriage and family therapy. Also today we have with us Ken Kinter. He has worked with people with mental illnesses and addictions throughout his 30-year career. This includes 25 years working in psychiatric emergency settings, partial care programs, and in a county jail. He has worked for UMD&J Rutgers for 16 years. His current faculty appointment is in 2 different projects, implementing evidence-based practices in psychiatric hospitals and implementing motivational interviewing at several New York, New Jersey service providers as part of the Mental Health Technology Transfer Center grant by SAMHSA. Mr. Kinter is currently completing his EDD, and his dissertation involves predicting and preventing 30-day readmissions to state psychiatric hospitals. He has also published on Lean Thinking Six Sigma, deinstitutionalization, wellness centers, and illness management and recovery. He and his wife also operate a therapy practice in Bordentown, New Jersey, where he works primarily with people with addictions and with families of people with severe illnesses and addictions. I'm going to turn the webinar over to our presenters, PJ and Ken, and welcome all.
Welcome, everybody. We're going to start with our objectives. And what we're going to try to do today is really address compassion fatigue and burnout and how those two are different and how sometimes they can look the same. We're going to address ways that we can increase the compassion for ourselves and others, and identify some things that will enable us to do that. We're going to talk about self-compassion, which is something that is coming on the horizon more and more about people who are in the helping profession having self-compassion. And we're going to talk about what that is and how it looks and what blocks us from doing that. We're going to describe some things that we can do, some strategies for regaining and replenishing not only our compassion for ourselves, but for others, and how we can address things like burnout and compassion fatigue. So we're going to start with burnout, and I encourage you to put in the chat box ways that you are feeling when you're feeling burnt out. And we have three definitions here. The first one, I highlight the words work-related stress, because burnout does come from our jobs, and it is long-term and it's based on demanding work. So that first definition, which you read there from the Mayo Clinic, describes burnout and how it affects our physical, emotional, and mental well-being. The second definition by Dr. Brewer, which is widely used, and again, I highlight some of the key words. When we're overdoing things, when we're not being centered, when we're not listening to ourselves, to our body, to how we're feeling. But my favorite definition is the last one that comes from Dave Muller, and that is there is more going out than coming in. And I think that's a real easy way for us to look at burnout. So potential causes of burnout are listed here, and we're going to talk about each one of those. Lack of control is a very big one. And right now in this era of COVID, a lot of us are feeling that we have no control. We have no control over the fact that we're working at home or we're in person. We have no control over the fact that we're on remote learning, or our children are on remote learning, or we're not on the same page in terms of responsibilities now. We have no control over things like how the vaccine gets rolled out, things like that. We certainly do have control over some of the behaviors that we exhibit, but there is a general sense of people are unable to control the things that are going on around them. And especially on the job, I hear educators and even students telling me every day they feel like they're starting a new school day, because sometimes they're in person, sometimes they're remote, sometimes they're supposed to be a hybrid, but then it ends up being remote, and it changes regularly. Unclear job expectations. In this era where educators are now doing remote learning, I have a lot of educators who say to me, I did not sign up for this. I signed up to be a teacher in a classroom teaching children who are in front of me. So again, it is really unclear. There's lots of platforms, and I don't know about the schools in the USVI, but in the schools in the States, they start with one platform, and sometimes the schools are changing from one platform to another. So they start with Google, and then they move to Zoom, and then they're on Microsoft Teams, and trying to keep up with how each of those works and how to use those when you're teaching, again, can contribute to a lot of stress. Dysfunctional workplace dynamics. If you existed in a school system that had dysfunctional work dynamics prior to COVID, in some situations they have gotten better, in some situations they have gotten worse. But again, that certainly does contribute. A mismatch in values. And sometimes we see that in educators in terms of the values that the educators really hold very close to their heart, and the values that maybe the administration holds. In the States, we often have a big discrepancy between administration wants to push for test scores, and teachers just want to teach and have children love to learn and be, in the classroom and engaged. So again, there may be a mismatch in our values. There may be a poor job fit. When somebody's going from one job to another, and the same things keep happening, It may be that it's not the job. It may be that I'm burnt out from what I'm doing. But sometimes the job may be a poor fit. If we're in a school where we don't feel valued, or where the job that we do isn't respected, that may be a poor fit for us, and we may need to change jobs. And then there's extremes in activity, which of course we are seeing right now with, I know in one of my schools, the educators were saying for their observations, they have to take pictures of what they're doing in the remote classroom and then upload them for their observation, and then have a discussion with their boss. And they're having to do all these extra steps for the observation, when in the past it was just that the administrator came into the classroom and observed them. So there are some extremes in activities that we're seeing during this event. And there's some new thoughts on burnout. So the research on burnout is always being conducted. And some of the findings are that there are people who will thrive no matter what. And what I find is those people who thrive no matter what really have some very excellent self-care. They have some excellent supports in their lives. They have some of the things that we're going to suggest later on in the presentation that you can do. But we often think of burnout in terms of people who are just working in the healthcare right now. And the reality is that it's not just healthcare workers or first responders. Today's modern life, or the new life, is very stressful. And the fact that we know that burnout in you doesn't necessarily look like burnout in me, doesn't necessarily look like burnout in Ken. It can all look different. So how burnout manifests itself in our lives, we're going to see how that can vary from person to person. And we also used to think that burnout was only those people who had been in the system for a very long time, maybe who had been in teaching for 30 years, and people were like, oh, they're just burnt out. But we're finding that burnout also affects new practitioners, new educators as well. And the key is the imbalance between what we expect and the reality of what we experience. And then that burnout is not a dichotomous condition. In other words, it's not here and then gone. It's not present and then absent. It's just more of a lower emotional continuum that we're looking at. So some of the risk factors of burnout, and that is if you identify so strongly with your work that you lack balance in other places of your life. And I'm hearing that a lot from educators who say, with the remote learning, I'm on the computer all day with my kids, and then I feel like I'm grading papers all night, and then I have to do education with my children, and everything melds into each other. I go to work from 8 to 3, I get off work, I go home, I have home time, maybe I have playtime, and we're sort of letting that all meld together. And we really, we're going to talk about how we can get some balance back into our lives. If there's a higher workload, including overtime work. And in the education system, that used to be something that we signed up for and we got extra stipends for, but the workload now and the expectations is going long past the workday, answering emails from parents and answering emails from children who don't understand something. And so educators are feeling like there's a higher workload. When we try to be everything to everyone, and I call that the superhero syndrome, and we'll talk about that a little bit later, but we're not superheroes. We are heroes, those people who are in the education system. I truly believe that, but we are not superheroes, and we need to not, try to be superheroes. Feeling that you have little or no control over your work. And that is something I hear all the time. And we talked about that just a few minutes ago. When your job is monotonous, or there's so many wide variations. And in the era of COVID, we're really seeing that wide variations. Sometimes we're hybrid, sometimes we're remote. When we are remote, we're talking about going back on this date, and then that date gets pushed back. And then we're talking about going this date, and then that date gets pushed back. And so we're talking about a lot of variations that, again, contribute to the burnout. And so what does it look like? So it looks like, the first one is we become a little bit more cynical, sarcastic, critical. And a lot of times we may not recognize it in ourselves, but I always tell people, pay attention to those around you. What are your children saying? So I was in a seminar with Nadine Burke, Dr. Burke, who does a lot of work around ACEs and trauma. And she's at home with her 3 boys and her husband. And she said, my son said to me, mommy's lost her giggle. And she realized that she hasn't laughed as much. So again, have you lost your giggle? Have you lost your ability to laugh? And we'll, talk about that a little bit later. But do you have to drag yourself to work? And prior to COVID, it used to be we had to get in the car and get ourselves dressed and get out the door and get to school. Now it's we have to get from maybe our bedroom or the kitchen where we're having coffee to the computer so that we can be online. Is our energy level waning? Are we lacking the energy to do our job from day to day? Are we waiting until, Friday? Like, thank God it's Friday and I don't have work Saturday and Sunday. Are we having difficulty concentrating? I know that the students are. So I can't imagine that some staff are not having that same problem as well. And do we lack satisfaction from our achievements? And when I talk about this with educators, I really talk about we need to lower our expectations of our achievements. So achievements are no longer your teacher of the year, or you're getting an award for high scores in math or whatever. An achievement might be that you get 10 out of 15 students engaged in your class in the morning, or that every student has responded to you, or that you gave a quiz and 90% of your kids passed the quiz. So again, our achievement expectation has to be a little lower. Do we feel disillusioned about your job? We talked about that. Educators are constantly saying to me, I did not sign up for this. I signed up to be a teacher. I love teaching. I love interacting with my students. This is not teaching. Are we having an increased use of substances? And we know that since COVID started, there's been an increase in alcohol purchase. I know originally it was 55% increase in beer sales and 117% in wine sales. I don't know what those numbers are now. I can't imagine, because I do have people saying to me that they're having a glass of wine, daily, or, they're having a beer daily, or something like that. And have we changed our sleep habits? That is something also that I'm hearing all around the board, from health practitioners and students and educators saying either I sleep or I can't sleep, or I wake up in the middle of the night, my students, I'm sleeping all the time. So again, have we had a change in sleep habits? And then there's those somatic complaints, my stomach hurts, I have a headache. And we typically assign those to children, those sort of somatic complaints, but it is amazing how we as adults can have some of those same complaints, because I hear children say, oh, mommy has a headache again, or mommy's not feeling good again. So again, listening to the kids is a good sign. I'm going to hand this part over to Ken.
Hey, good afternoon, everybody. First thing I wanted to say is that PJ's background is not New Jersey. We still have snow up here, so maybe that looks more like the USVI, but it is definitely not what's going on in New Jersey right now. Actually, we were just a year ago, we were down doing some trainings with you guys, and we enjoyed the weather this time of year there much better than up here. So we'll start with that. But anyway, moving on to compassion fatigue. So we're going to make a differentiation between burnout and compassion fatigue, and we're going to compare them head to head in a minute. So compassion fatigue is basically the idea that when you work around people or animals that are in distress, you take on a little bit of that distress. So everyone that you work with, whether you work in healthcare or working with students in education, you give a little bit to everybody, and you also take on a little bit of what's going on with that person. And some of those stories are not nice stories. So you take on a little bit of that. And so burnout, if you work for a school, the burnout would have more to do with aspects of the school. Compassion fatigue would have more to do with the actual students, and just that cumulative stress of dealing with people that are in stages of distress. And it's cumulative, and it's very subtle. It sneaks up on you very slowly, but then all of a sudden it happens. So here's a pretty good comparison of compassion fatigue versus burnout. Compassion fatigue is much more on a personal level as opposed to organizational. And it's not even the workload or the structure of stuff that comes with your work, but it's the stress that comes along with the emotional toll. PJ and I have remarked, working in therapy, it's amazing how tired you can get in 45 minutes sitting in a chair. You can literally exhaust yourself with the work you're doing, despite the fact that you haven't even moved. And it's that emotional stress. So compassion fatigue is much more internal. Both of them affect all of you, as we're going to talk about. There's a whole constellation of symptoms for both of these. And it's really critical to catch where that impacts for you, because we're all different. We all respond to stress differently. The reason that we have to differentiate between these two is stress, when it gets really big, can feel like one big unmanageable ball of stress. And this is part of breaking it down into smaller pieces, so we can see what part of this is due to the structure of my job, what part of this is due to the emotional toll of my job, because that helps with finding a solution for it and turning this around. So here's that look of the constellation of different symptoms that compassion fatigue can hit. And I'm not going to go through every square on this. I know you can see it. But going across the top row there, you see these different domains. The cognitive domain, the emotional domain, behavioral domain, and you see how these can all impact people in different manners. And you see it all the way into where it impacts your personal relationships, your physical well-being, and work performance as well. And like PJ said before, no two people will respond exactly the same, but it will turn up these different aspects of what's going on with you. So here's a look at some of these dimensions a little closer up. Behaviorally, we may find ourselves becoming more irritable, more impatient. We may see impacts in our sleep and our appetite. Physically, we all manifest stress differently in our bodies. Think about, there are some people who they manifest stress through cardiac. You might have more of a fluttered heartbeat or a rapid heart rate. We have some people that may be really profuse sweaters. If you've seen some people, I've seen some people under stress, like sweat right through a shirt, just from the sheer stress of what they're going through. With some people, it's more muscular. You might have somebody who's, keeps their shoulders locked up, and the next thing you know, they have a lot of neck and back pain from that continued stress. With some people, they may get dizzy. With other people, you may feel their blood pressure. There's any number of somatic areas where this manifests, but stress is that root, where it all comes from. And PJ made a very good point before. People start feeling these things, and the first thing they do is go to their medical doctor and get the symptom treated, but not the thing underneath. So we're going to treat that ulcer for you, but not the thing that's causing you that ulcer, which only guarantees that ulcer is going to continue. So before, like we were saying, it'll definitely impact work performance. In fact, the last group that we met with, we talked about people whose, burnout and compassion fatigue manifest as they're getting ready to go to work. That may be the hardest part of your day, is just getting ready to go back into that fray again, because especially in the last year, there probably has been a lot of additional stress, a lot of additional demands on you. Like was said, stuff that wasn't signed up for, but it still has to be done every day. So that impacts your morale, it impacts your motivation, it impacts procrastination, which I could go on endlessly about. I'm pretty good at it. And just impacting, I love this example of having unwanted memories of past events from work. So again, it talks about how cumulative this is. Because with compassion fatigue, it takes a little bit out of each of us, but there are certain situations. I'm sure if you've been working in the schools for a while, there's certain students and certain situations that stay with you longer. In fact, when PJ and I were down with you guys a year ago, people were talking about the hurricanes, the particularly bad hurricanes that you guys got. You don't forget that, and you don't forget ones that came up in the past as well. Also, personal relationships. People may be more withdrawn. They may be more silent. They may be more angry. So there's going to be a shift. There's going to be a change. When someone's not themselves and they just move in this sort of direction that they move in under stress. So you see some of those aspects here. Cognitively, I know I don't see this one on here, but I would throw decreased memory on as well. Stress can definitely impact someone's memory, concentration, how you feel about yourself, even a sense of being disoriented, not even knowing where you are. it can function at that level. Also emotionally, feeling powerless. We're going to talk a lot more about that. Feeling guilty, rageful, survivor guilt. If people around you have really been impacted more than you have, and maybe you've been a little fortunate through this in the last year, but then there's that guilt that comes along with that. Being emotionally shut down and numb is another big one. I worry more about people that are shut down than people that are actively hurting, because now it's like they've ducked down into a trench to try to avoid being hurt further, and also the helplessness. And one of the biggest ones is in the aspects, spiritual aspects. So that's a really big one, because I would say in the last year, there are people asking a lot of questions, and how do those questions get answered? A lot of those questions are questions no one can answer. Where did this come from? When is it going to end? When are we going to be safe? Are we going to go back to normal? What's the new normal going to be? And when does it start? These are all magnificent questions that nobody can really give you the answer to yet. And when people don't have answers to things, very often they turn to spirituality. And also I've noticed that when people are under stress, their spirituality or their faith sometimes is one of the first things that go, and of course with this one, houses of worship became a whole other issue. Where do I go to feel better from all the stress in my life? I go to my local house of worship. Well, now that's closed, or they're doing it some other way in Zoom or whatever. And it's not the same. So it's very difficult when your go-to for stress now becomes a stressor. That becomes really difficult. So that can manifest in disengaging from your faith, or it can be outright anger, anger at God or anger at whatever. So that's a really big piece, during times like this.
So one of the things that happens when we are experiencing compassion fatigue is there's another component of that that's called secondary traumatic stress. And that is when we are working with people that, because of their exposure to trauma or events that are happening with them, that we experience some of that stressful events as well. And I know that when we were down there a year ago, like Ken said, doing some trainings, we were talking to people in the field, in healthcare, in education, who were saying that they still had children who were displaced from homes, and that, didn't have the necessary things that they needed for school. And so it was very hard to see those children every day. And now, of course, with COVID, we're having children who are coming to school who are losing relatives and things like that. So sometimes all of those stressful events that we are interacting with students and clients and things like that really takes a toll on us. And so it's really important for us to look at that. So what does secondary traumatic stress look like? It can be a very rapid onset. So sometimes we don't even know. It's sort of that old adage that somebody says, I have no idea what hit me. It was just that all of a sudden, I'm helping these students and helping these students and helping these students. And there's that one student who needs something, and all of a sudden I've just hit my limit. So it can be pretty rapid depending on what the events are that I'm working with. It can be associated with a particular event right now. So again, when we were down there a year ago, and I don't know what the status is now, but there were a lot of homes that were still disheveled and still not repaired, and people who were still living in dwellings with friends and family and on top of each other because of those things. And again, so some of that trauma, if we're experiencing that, so if I'm an educator, maybe my home was destroyed and I'm living with other family and I'm stressed and I'm interacting with students who have the same events going on in their lives, that can again contribute to that secondary traumatic stress. Being more afraid of things. We're definitely seeing that in COVID. I hear educators saying to me all the time, I'm afraid to go back into the school. I'm afraid they're not cleaning it properly. I'm afraid that I'm going to contract COVID. Being afraid of all of these things. And, on our webinar on Monday, with some other educators in your area, they were talking about how they are feeling very distrustful of, environments outside of their home where they can control what happens, but when they go into another environment, they can't. Sleep and appetite changes are a sign that sort of is pervasive through all of these: burnout, compassion fatigue, secondary traumatic stress. But it keeps coming up because it's one of the telltale signs that something is not going right in our life. I was actually reading an article earlier about children in COVID, and they were talking about children emotionally eating more, and that, they're at home and it's accessible and it's right there. And so they're eating more. And how do we get them out of that pattern? And I know that's happening to some adults because I hear people telling me that. My husband makes a joke and says that it is the COVID-15. Like, you used to go to college and have the freshman 20. Well, this is the COVID-15, that you're gaining 15 pounds because of the COVID events. And again, reoccurring images of upsetting events. Those are things that, we have in our head and we keep seeing them, not like a flashback, but more like an intrusive image that jumps into our head. And then, avoidance of things that do remind us of the events. So of course we want to avoid being in school, and we want to avoid the students, and we want to avoid, anything that looks like something that could be harmful. So we're going to do a little exercise. I'm going to ask Ken to put the link to this also in the chat so that you can hook onto it. This is the professional quality of life scale. It's called the ProQual. And what it does is it gives you a measure of whether you are functioning in the area of compassion fatigue, whether you are functioning in the area of burnout, or whether you're functioning in the area of secondary traumatic stress. It's a 31 item checklist. I'm going to bring it up in a few minutes, but we're going to give you a few minutes to actually complete this. So I would like you to go to the site, either the link in the chat, or you can put the link that's on the screen in your, URL area. And I'm going to ask you to fill this out as we're talking, because this is a gauge of where you are functioning. And I tell people that I use the ProQual all the time. I periodically, every 3 to 6 months, depending on what's happening, I do just take the ProQual and see where I am functioning. Because I do trauma responses, and I'm still doing trauma responses in the era of COVID. And because I have, a private practice and I'm working, sometimes I can not recognize that I am maybe overworked, or that maybe I'm burnout, or that I am having a little difficulty having compassion for those people that I'm working with. And so I take the ProQual myself just so that I can see if I'm missing anything. And where is my level at? Where am I functioning? Because if I come up high in burnout, then I say, okay, I'm, experiencing some symptoms of burnout. I need to do something to bring this functioning level down to a more healthy level for me. If I'm suffering compassion fatigue, certainly as a therapist, if you're suffering compassion fatigue, that's kind of a hard place to be. So again, can't help anybody else unless I help myself. So I, again, assess where I am functioning at. So I'm going to give you a few minutes to complete the ProQual. And for those of you who maybe can't get online, I am going to bring it up. I'm going to bring it up here so that I can show it to all of you. All right, so I'm going to share my screen again. So even if you can't bring it up online, here it is. It's a 5-scale assessment. So 1 is never, 5 is very often. And I tell people, go down the numbers, read the sentence, and respond to whatever the first thought is that comes to your mind. Don't spend a lot of time thinking. Wherever you see help or helper, that's you. That's, you as the educator. So, again, read the question and answer it as quickly as you can. So if you can't get to the link online, you can certainly just take a piece of paper and write the numbers and your number one, I put a 2 there. Number 2, I put a 4 there. And you can do it on a paper pencil and we'll help you score it in a few minutes. So I'm just going to give you a few minutes to do that. I will keep moving my screen up in case you are doing it on my screen. And I'm going to ask Kadi and Ken to really pay attention to the chat and see if people are having questions about it. And I also would ask you to let us know when you're finished, at least the question part. There are, like I said, there's 30 questions. So I'm gonna hover around 4 to 23 for a few minutes in case you're using my screen to do it. And then I will move my screen up.
Has anyone made the link work yet? I was just looking to make sure that that it worked for you guys. Okay, good. Thank you, Audrina.
So I'm gonna move my screen up again in case you're using it. Thinking people are past 12 now. And again, I encourage you to, save this link. And again, periodically just come back and assess where you are. Like I said, I use this regularly. I really feel like it's very helpful for me. And so in the chat, if you guys can just let us know if you're finished the questioning part, the 1 to 30, that will help us to know when to move on. Normally, if I was in person, I'd be passing this out to you on a paper. And then we would be scoring it together, which would be much easier for me to know when people are finished or which part they're working on.
You can watch pens and pencils being put down. That's very helpful.
All right, if anybody is using my screen, I'm going to assume that you're finished the question part. And I'm going to move my screen to the scoring part. That in between part that I just passed will give you just some more information about compassion, fatigue, burnout, and secondary traumatic stress. But this is the important piece. This is the scoring part. So the compassion satisfaction scale is real easy. You have the questions here and you just put in your scores and you total it. And then it'll tell you on the right what your score, what the interpretation of your score is. You know, do you have low compassion satisfaction, moderate, or high? You know, the burnout scale is the one that is a little trickier, but if you look at the little scale on the left, you see the numbers that question numbers that are starred, that have a star beside them, 1, 4, 15, 17, and 29, you reverse your score. And it gives you the little cheat sheet in the corner. So if you wrote a 2 for number 1, you give yourself a 4 when you're figuring out your total. If you wrote a 4, you give yourself a 2. I have somebody saying they completed. Thank you very much. And then again, the secondary traumatic stress scale is very straightforward. It asks you the questions and you fill in your response, and then it'll tell you. So I'm gonna be basing this on Adrina, who said she is completed. I'm gonna be hoping the rest of you are in the same ballpark of time. Gonna give us about 5 more minutes, and then we're gonna move on a little bit. So total up your scores. Look at what your scores are telling you. Just going to make sure, is there anybody who's using my screen so that if I leave it, I don't want to leave you hanging? You can just let me know in the chat if anybody's using my screen. I'm not seeing any responses, so I am going to minimize my screen and go back to the PowerPoint. Ken, can you see my screen?
Yep.
Okay, we're good. All right, so here's the things that we need to do. What does our score tell us? So were your scores what you thought they would be? So those of you who did this, were your scores what you thought they would be? Did you score high in burnout and you didn't think you were burnt out? Did you score high in another area? Did you score high in secondary traumatic stress? You know, were your scores what you thought they would be? Usually when we fill out some kind of assessment like this, we sort of are have an expectation of what our score is going to be or what category we're going to be in. Okay, we have somebody who didn't break them into categories. Okay, great. Look at it later. So what we ask you to do right now, and it doesn't matter where you fell, whether you fell a high score in burnout or a high score in STS or a high score in compassion, satisfaction, is we ask you to write 3 things that you do well while performing your job. So if you can just put those in the chat box, 3 things, and if you can only think of 2, I'm not going to press you, but 3 things that you do well in your job. So if you can all add in the chat box 3 things that you do well in your job. Let us know what those are. So do I have anybody who's going to tell me 3 things they do well in their job? I think everybody is a little shy to contribute in our group.
There we go. Strategic planner and thinker, engage with others, and time management tools. Very nice.
Okay, great things to be good at.
Mhm. Mm.
Working alone, connecting with families, will work well with stakeholders. Wonderful. I would really encourage everyone to at least think of one thing. It would make me worried if I think we have people in the room who can't think of one thing that they do well on their job, because I know as educators, you guys do a lot of good work. So
I
again,
would also stress that I know that a lot of people's job satisfaction has been limited by the fact that they can't do the job to the best of their ability for the last year. They really feel like you're operating at a disadvantage. And, from our limited experience in the USVI, you guys don't have tons of services competing with each other. There's some areas around here that there are lots of different services that are helping out and others that aren't so much. And so some of these skills that you mentioned are critical because you have to be able to work with the services that are existing that can help. That's critical.
good
Manage
point.
time, accomplish a lot in a day. Good.
So then, the question is your job stressful? And again, what about it makes it stressful? And sometimes we are able to identify stress in other people, in our coworkers. We'll say, oh, that person's not doing XYZ because they're so stressed out. But what about it is stressful?
Mhm.
I hear very stressful.
Stressful. Yeah.
So, and again, what are some of the things that make your work valuable? Why do you do what you do? And you're going to hear us come back to that a bunch of times, remembering why we do the work that we do. Even in this time where things are so stressful, there are things that come up every now and then, and you're able to go, oh, that's why I'm a teacher, or that's why I'm a school counselor, or that's why I'm a psychologist. I remember, sometimes when we get lost in the stress and the burnout, we forget why we do what we do.
Sure. Part of it is why we got started in this field in the first place. And part of it is just identifying who we are. When I hear somebody say, that's what I do, this is what I do. Our work and our self-image are very interconnected. Sometimes they're over interconnected, as we've talked about. That can be taken too far. There is a separate you from your work, but it's natural to identify with what you do. Certainly in things like education and in healthcare, where your job is literally to help people, or to educate people.
What a great comment.
Really good point. Really good point. And I'm sure that's true for everybody. Everybody here. I'm sure everybody can share in the very stressful. Probably could have shared in the very stressful more than a year ago, but definitely now. And 100% correct on the second part. The students are dependent on you to model a sense of normalcy. What other sense of normalcy do they have? If they're lucky, they have other people to model that, but we can't count on that. And I'm sure you all know cases where that is not the case.
Sometimes, when you're in the school system, children are reliant on you just as if you were their parents.
Sure.
So again.
Yep.
So we're going to move into what is self-compassion, because this is what we're finding is going to be the prescription, if you will, for what ails us. And we really want to define and differentiate between what empathy and compassion are. We're going to discuss self-compassion, and we're going to discuss things that either contribute to that or block our ability to have compassion. And so self-compassion is really about being kind to ourselves. And a lot of times, and I've seen this in educators, they will go to the ends of the earth for their children. Counselors in the schools, psychologists in the schools, they're always trying to figure out how to get those kids everything that they need, but they're sometimes not as kind to themselves. And when we have little self-kindness for ourselves, we do have difficulty with sometimes happiness and optimism and things like that. And we really need to understand how that self-kindness and self-compassion really has a positive effect on some of those things that affect us so deeply and so spiritually. We also, when we lack self-compassion, sometimes we become intolerant of other people, and people, we are very tired, and then we don't have that energy to maybe give to the best of our ability. And again, self-compassion is directly related to and precedes our compassion for others. It's that old adage, if I'm in the airplane and the oxygen masks drop, I have to put on my oxygen mask first before I can put on my child's. So we can help other people if we can help ourselves. And that's where we really need to be the vessel full of compassion. I love that line. So I'm just going to read that right off the slide. We have to be the vessel of compassion so that we can have compassion for others, and they in turn can have compassion. So again, the more suffering, the less compassion, and then the suffering, spills out onto other people. And again, how much suffering do you experience as a part of your work or your life? I know that in the event of a crisis, like COVID or hurricanes or, natural disasters, there is a lot of suffering that we experience. When I go out to a traumatic event and I bring a team with me, there are times when I will have a team member say, I can't do this today. And again, I would rather have them go home and take care of themselves than to be on a crisis event with me and not be able to do the work that we need to do. So again, need to be aware of that. So there's a lot of research right now on self-compassion. You can look it up. It's a big growing area of the helping field. And what the researchers in the field are identifying is that there are really three components of this. The first is kindness, which again, I don't need to, describe what kindness is. I think we all understand that. The other is a sense of common humanity, seeing our experiences as part of the larger human experiences. And I know that during COVID, there's been the whole thing of, people saying, oh yeah, we're all in this together. And then people saying, no, we're not all in this together and it's different. But we need to be able to attain sort of that sense of common humanity instead of being separated, really coming together. And then the whole idea of mindfulness, and we're going to talk about some mindfulness things later. And I know mindfulness has been a term that's been definitely overused in our field. I know that in the schools, some people say to me, oh, I'm so tired of hearing about that. But it really is something that we're asking people to look at, because it's not about something I have to do. It's about really balancing, the painful things that are going on and the painful things we're experiencing with some things that we identify that can help us feel better. And again, self-compassion is not self-centeredness or being selfish. I know when I tell people, you have to take care of yourself, and they say, oh no, I have so many things to do. I have to take care of all these people. If I would do that, that would be really being selfish. And it's not about being selfish at all. It's about really, again, putting your oxygen mask on before I can put other people's masks on. And the other thing the research is showing is just this last comment, is that self-compassion is being shown to stimulate brain activity. So that, that part of the brain that evokes the empathy and compassion and kindness for other people. So again, it helps us as much as it helps other people.
So, yep, we're going to talk about empathy and compassion. at the risk of beating the compassion thing to death, but it's really critical. In fact, we'll get a little more into that. So first off, before we even get started with this, we'll talk about the difference between empathy and sympathy. Sympathy is feeling bad for someone. Oh, I'm so sorry that happened to you. And it feels a lot like pity, and people aren't too thrilled with being pitied. That doesn't help someone. Empathy means sharing the feelings of someone, using your own experience to be able to try to connect with another person's experience. You can't share it completely, but you have the best idea that you have. You might not know what someone else's sadness feels like, but you know what it's like to feel sad. So that becomes the equivalent. So empathy is about sharing the feelings of someone else with someone else. Compassion is more specific, and it really goes down to the root of the word, compassion, suffering with. So you suffer as that, as close as you can to as that person suffers. And then because of that compassion, there's a compassionate act that comes from that. Just to give an example, I broke my foot in a couple places a few years ago. And I realized that for people that need some assistance to walk, doors are not their favoriteest thing in the world, especially when you get someplace where you have multiple doors that you have to go through, especially when you're on crutches or if you have a walker, it's really, really difficult. So for a couple of weeks, I had not a good time working my way through all of these doors, especially if you got to lock them and unlock them on one foot. So because of that, when I see people who are ambulating with walkers or someone in a wheelchair, something like that, I will hold a door. I am just not in that much of a hurry that I have to let somebody struggle with the door the same way I did. Now, for me, it was only a few weeks, but I'm aware that there are some people that have to deal with that, for the rest of their lives. So that to me is kind of where that empathy comes from. It's not, oh, I feel so bad that that person's in a wheelchair, has a walker, and then goes about my life. It's that feeling, that sharing of suffering, which then leads to that act. And I'm sure you all have examples of that as well. You have I'm sure those of you who lived in that area have gone through many hurricanes, survived many big storms. So when a new one comes around, and your students might not be as familiar with this as you, and you've been through this before. So you've got some experience and you've got something that you can bring to the table to help people. Now, COVID, that's a once in 100-year thing. So I don't know how many people are around that have had experienced this firsthand, but you draw from your own experience, to help yourself through this, and then help someone else through this. And just to go on what we were talking about before with self-compassion, compassion is almost another word for kindness. The compassion leads to that act of kindness. If compassion seems like too much of an abstract concept, it's just about being kind, starting with kind to yourself, and then continuing on with kind to someone else. So this is a pretty cool infographic. I'm a big fan of this. And before we get into that little graphic on the right, let's talk about the difference between shame and guilt. Those are two words that we know very well. Sometimes they get used interchangeably, but there's a rather important difference between them. So shame, unpleasant emotion, and it contains a negative judgment about ourselves. But the big difference for them between these two are, for me, guilt is I did something wrong. It's focused on an action or something that was done. Shame says I am something wrong. So there doesn't even need to be a behavior. That's kind of a 24/7 thing. So shame is a pretty brutal thing. And of course, when we have a lot of shame on ourselves, we may also be very quick to shame others as well. The sword we cut ourselves with is the sword that we cut others with as well. So let's move on to this graphic on the right. I really like this transforming shame into self-compassion, because we're all carrying this around. I'm sure we're all carrying a little tape in our head, and some of the things that tape says to us is not so nice. Or you may describe yourself as your own worst critic, your own harshest critic. So you might be your own harshest critic, but that also means you're probably a harsh critic of others as well, even if you do it silently. So let's start off with step one here. We see our little shame guy here. Shame is normal, and shame is the brain's way of dealing with the threat of disconnection. So shame is a naturally occurring thing. But we also need to, moving on to step two, labeling for what it is. It is a type of emotion. It's an emotion with a judgment attached to it. So you acknowledge it for what it is. And here in step 3, I almost like, to me, I think adults tend to be much more full of shame than children are. Children, I believe, are much more full of curiosity. And I think we have something to learn from them in that area, where we want to replace that harsh critic, that harsh judgment, with curiosity. So instead of judgments, let's ask questions. Let's pretend, because shame and the judgment assume that we know something. Well, maybe we don't. Maybe we think we know something and maybe we don't. So how can we replace that and start asking questions to learn more about it instead of going to the judgment? Acknowledge your inner critic, because the job of that inner critic is to amplify your shame. And here's a news flash for everybody. None of us are perfect. None of us. We aren't now, and we aren't going to be in any time soon. So, and to be okay with not being perfect, because as our program director always says, perfect is the enemy of good. What we want is good, or what we want is better, and the quest for perfect sometimes leads us a little astray. I'll give you an example. We got a big delivery of rocks for our driveway, and I spent 3 days trying to think of the best way to move those rocks around the driveway. I thought about how I could do this, where I would start, and this, that, and the other. So in those 3 days, how many rocks actually got moved? The correct answer is 0. None of them moved on their own. And my 3 days of obsessing about it didn't get me any closer to getting the job done. So in my case, the quest for perfect was the enemy of good. So finally, after 3 days of procrastinating and obsessing a bit, I said, you know what? I'm just going to start moving some rocks. Let's just see what happens. Get a wheelbarrow, get a shovel, and let's go. And while I was doing the job, I figured out how to do it. And no, it wasn't perfect, but it got done. And that was the real critical piece. So that brings us to step 5, practice what is helpful, not harmful. What would be helpful? What's the next step to improving things? One small step. Let's not do a big step. In fact, usually the big step is a bunch of small steps all crushed together. So what's one small thing we can do to make a positive change that will move us in the right direction, as opposed to shaming ourselves or criticizing ourselves or doing that toward others as well. So that's that transformative process. So there are also a couple other things that stop us from being fully compassionate. One is, if we don't know the people that are affected, we're much quicker to respond to the needs of someone we know than someone far away. And that's a natural, human response. If you know someone, you're like, oh my goodness, we got to do something about this. If it's a stranger, maybe a little less so. Another compassion blocker is compassion fade, which means there are too many. So when I say there's over 60,000 homeless people in New York City, my first feeling is, oh my God, what can I do? I can't do anything for that many people. And the reality is, because I'm worried about the 60,000, I'm not helping the one I can help. And we'll tell a little story about that later on. And then here we are back to compassion fatigue again, which is, I've helped too many people already. We just keep going and going and going and going. And then it's just not there. The thing you're looking for just isn't there to be able to help. And as this little COVID crisis has gone from weeks to months to very close to coming up on a year, here in the US, you see that fatigue coming on, because now you're just not teaching for the month or this particular semester or a marking period. Now you're into the year. And I remember when one year ended and then the other year began, and then was it, okay, are we going to keep this going? And I don't know about where you are, but here there are all these shifts about whether we're going to do hybrid or whether it's going to stay fully online, and it's being done differently in every place. So that becomes fatiguing as well. And our own traumas, we're all walking around, most of us, I would say, are walking around with some sort of trauma, and other traumas will pile up on that old one. The analogy I always think about with you guys is, you guys have been through a bunch of storms. Now up here in the Northeast, we watch them on TV and we go, oh my goodness, those poor people. What do you do in 100-mile-an-hour winds, 125, 150 mile an hour winds? How do you live through that and then rebuild, and then live through that and rebuild again? And of course, in the process of that, you see things and you experience things that aren't so great and that leave kind of their own marks or scars on your memory. And then it comes around again. And that can lead us to some of these other reactions. If you see the trauma reactions of fight, flight, and freeze, there are other things that stop us from being compassionate. And the short version is we're hurting so bad, we're suffering, so it's hard to be compassionate to others. We really need a certain degree of compassion for ourselves before we can reach out to others, or it just doesn't work. So I don't know if any of you have seen the movie Office Space. It's a hilarious movie. If you haven't seen it, find a way. It's worth a good laugh. And here we have a scenario here where we have someone who it's their birthday and there's a birthday cake and they're cutting too many pieces of big cake. And this guy knows he isn't going to get one. He's saying it the whole time. And of course, there's everybody else eating their cake and he doesn't have it. So those of us who work in helping professions, education, mental health, medicine, we just keep giving away pieces of ourselves. And actually, when things are harder, we're getting less and we're giving more. And then what happens is we give to the students and we give to the parents and we give to our peers and to the school. And of course, we have our own families and lives and responsibilities. And we get to the end of the day and there's no cake left for us. And that's a really difficult place, to be, especially over a long period of time. So now those of us who work in these types of fields, we have additional threats because first of all, we're in a crisis ourselves, trying to help other people through a crisis. Good luck with that, right? That's pretty difficult. It's one thing when things are okay with us in our lives, but then when we're being affected by the crisis that's happening around us as well. And very often educators as well as people in healthcare we have this expectation that we have to view ourselves as superheroes. Now, of course, I have some highly flawed superheroes up on this slide, if you're familiar with Jay and Silent Bob. So there's a pressure on us to not ask for help and just keep going and keep going as if nothing was wrong, as if this wasn't impacting us. And that's really hard. Pressure not to speak to people about it, to pretend we're on top of it when we're really not. This third one is a big one in the hospitals where I work. People, and I mentioned it before, people are feeling guilty because they're not able to do the jobs to the best of their ability. And that's not a good feeling. We get a good feeling from doing our jobs the best we can. And when external forces stop us from doing our jobs the best we can, that has negative impacts on us. And sometimes we even sort of blame and shame ourselves out of that. The crisis is ongoing. Oh, the work-home boundary. Let's talk about that one. So those of us that work at home now, our home is now our office. So there's some good news about that, the commuting thing PJ mentioned before, but where's that work-home divide? I don't know about you, but I needed that ride home to sort of decompress so that when I'm home, I'm home. Well, now I'm not home. For the last year, our dining room table has been an office. Our home, the rooms in our house are where we work. So that line between work and home, which has always been blurred, now is completely blurred. And where can you go to de-stress? And of course, in a quarantine, where can you go? Where you can go is severely limited. Many of the things that people do for self-care, they can't do. I work with a lot of people with addictions. And the first thing that happened is all 12-step meetings stopped. That's not good. You don't want a lot of people that are recovering from addictions. Now they've got their main lifeline that keeps them well disconnected. So now everybody's doing the meetings on Zoom. And of course, as we already know today, that's not the same, but it's better than nothing. Changes to our self-care. Of course, our habits changed. We mentioned the COVID-19. Some of the other pieces that are on here, we're going to talk about anticipatory grief in a minute. But that pressure to keep going causes us to ignore our limits. So we push ourselves past our limits. And we don't realize that we're past our limits until things start going wrong. Medical things start going wrong, or we just break down somewhere. It could be just as simple as breaking into tears over something that isn't that particularly sad. And at a certain point you go, oh, this is me. This isn't this thing, and you just realize the depth of it in that moment. Another piece that's on here is attachment to the result. We are in survival mode. We're in survival mode. We are surviving a global pandemic and a crisis that has not been seen in 100 years. So the idea of, oh, we've lost a step because we're not doing things as well as we were doing them before. No, we're surviving. That's what we're doing now. We will work on thriving and improving and all that stuff as we move into a better place with this, which there are some signs that that's coming. But if we just hold ourselves to blame for where things are now, that's not a very therapeutic place to start from, and not accurate. So some tips for regaining compassion. We talked about this already. To a certain degree, compassion starts with you. What sort of work-life balance can you maintain? How can you make time to get away and to be able to clear out your head? Self-care practices. I can tell you one of the most important self-care practices for me has been walking the dog. Sometimes that's an island of sanity in an otherwise not so sane day, because it's simple. We go walk the dog loves it. You get outside for a little bit, you get away from what you were thinking about, so you get out of that sort of cycle of thinking. And very often I've come up to the solution for the problem while I was out walking the dog. So I'm very grateful for the dog for that. How do you take breaks? How do you take care of yourself? And also saying that, acknowledging that you're not perfect, that we're not superheroes, even Blunt Man and Chronic. We're not even that good. We're not superheroes. We're people doing the best we can for ourselves, those we love, and for those that we work with. This quarantine thing has gone from being a sprint to a marathon. When they sent us home from the hospital, I thought we were going to be gone for 2 weeks, maybe 4 weeks. I almost didn't bring my plants home. I don't know how that would have looked like after a year. I don't think that would have gone so well for the plants. So it's turned into a marathon, and you run differently during a marathon than a sprint. You sort of maintain yourself for the long haul. Not trying to take control over what we can't control. And there are two things on here. We can send these to you. We can email them to you if you're interested in them. The PCI is called the Personal Chaos Index, and we'll just talk about it, a little bit now. And it's basically, you can find it, there's a link here. And if you typed in Personal Chaos Index, it'll come up. Basically, it divides your life into 10 domains and then looks at each of those domains for what are your bad habits when you're under stress. So there's one section about physical health. Do you smoke more? Did you stop going to the gym? Has your weight crept in a not positive direction for you? There's another one about your transportation. Are you taking care of your car? Are you late for the bus? Whatever that sort of is. PJ gave a great analogy before. You have that person who says, well, I have a glass of wine before I go to bed. Well, then did that glass of wine turn into 2 glasses of wine? Did it turn into 3 glasses of wine? Do you realize that wine already comes in a glass? So why bother? So you're looking for all of those things that when the stress ratchets up, these habits change. So that's the PCI. And then the PSCI is something that I came up with borrowing heavily from the PCI, which is looking at those exact same domains. The form looks almost exactly the same, but instead of what are the bad habits that stress brings on, it's what's something you can do in the next week to turn this around. What's one small thing you can do, something easy to do in a week that you can do to help turn that behavior around so that you're taking better care of yourself. And it can be anything, any of those examples about smoking or the gym or walking or anything. There's nothing too small that doesn't count. It's just a positive change. And like I said, we can send these to you if you're interested in them. So anticipatory grief. Now this is something that it's not unique to this quarantine and to this pandemic, but it's brought it into a whole new light. So anticipatory grief is grieving in advance. Now, some of you who may have had loved ones that were very sick for a while, there's a piece of the grieving that you do when that person's still here. You're sort of planning, all right, what am I going to do, if and when this gets worse? What am I going to do if and when this person passes away? So you're problem solving, but you're also doing the emotional part in advance. But you don't know when it's going to be. It could be days, months, weeks, years. That's the hard part of that. So with COVID has brought that to a whole other dimension. We don't know what we're going to lose. Is COVID going to cost me my job? Is it going to cost me my health? Is it going to cost me my life? Is it going to hurt someone close to me? So, and there is no answer coming. We don't know that answer right away. We have to go through it. So anticipatory grief is sort of that anxiety and depression that comes from, one, worrying about these things that are beyond our control, and maybe even trying to control them. Because obviously we're trying to keep ourselves as safe as possible, but we ultimately do not have control over, what happens here. And anticipatory grief is rough, and the longer it goes, the harder it gets. So that's been a big piece of what we've been dealing with for the last year.
So we're just going to get into now some questions to ask yourself to see if you're at risk. And again, we talked about becoming more critical or cynical or sarcastic. Have you lost the ability to experience joy? Are we able to laugh? Have you lost your giggle? Have you lost your joy? Are you dragging yourself to work or having trouble getting started? Are you more irritable and less patient? I have a lot of, I was on a response around January, and we were outside under a tent, and we had a group of 6th, 7th, and 8th graders, and they were talking about how their parents are very irritable and losing their patience with them all the time. And the principal, who was sitting in the discussion in the back, acknowledged that he also is having trouble with losing his patience. And the students were so surprised to see that he had actually admitted that he was having some trouble in that area. So again, sometimes our kids are really good gauges for where we are functioning. And again, do we feel like the things that we're asked to do at work are just mountains that we can't climb? Do you feel disillusioned about your job? That statement of, I did not sign up for this. This is not what I, signed up with. I know, prior to the COVID, I was doing a lot of traveling, and I love to travel, and I love to go meet people, and I love face to face. And now we're doing everything remotely. Here we are remote with you. Do we no longer feel satisfaction from our achievements? And again, what are our achievements? We really need to lower our expectations of ourselves. That's some more of that, self-compassion and kindness, and think of our achievements in smaller increments. Where's our energy level? Where's our productivity? Again, do we have a hard time laughing at ourselves? I am telling people all the time, find a good laugh movie. It used to be when I was doing therapy, I would tell people who were really in grief and lost to, who were telling me like, I can't cry, I have trouble crying. And I would say, okay, find a cry movie, so that you can just sit and watch the movie and cry. And then the tears that need to come out will come out. Now I'm telling people to find their laugh movie. What movie makes you really have a big belly laugh or a giggle?
Actually, if I could jump in on that one for a minute, if you have a suggestion for a really funny movie, I would love to see that in the chat. I would be a big fan of that. So if you've got one that does it for you, I want to hear about it. I reserve the right to throw in a few of my own.
Absolutely. And again, are people asking you if you're okay? Are your children, are your coworkers? Again, Ken talked about, one glass of wine leading to a couple of glasses of wine, leading to the wine bottle. Are we medicating with some of those things? We've talked about sleep and appetite, and how some of our complaints, can be exacerbated right now. Again, identifying so strong with our work that we don't have a balance. A lot of times parents are asking me, everybody's so stressed and we're such in confined areas, and what do we do? And I keep telling them, there has to be a balance. There has to be a balance between you, work, school, play, time with the kids, all of those things. There also needs to be that same balance with your children. We are not superhuman beings, even as parents, and oftentimes parents are trying to be everything to all their kids, and you just can't. It's okay to say I'm stressed. It's okay to say I'm anxious. It's okay to say I'm afraid, all of those things that, we're feeling right now. Again, we talked about the job, whether it's, varied or monotonous. We don't have too much monotony, but right now. And again, if you work in the helping professions, which we categorize as not only healthcare, counseling, teaching, but also, law enforcement. So, that educator place working in schools has now become what I consider to be first response. Considering for yourself. So this is a really big one, like who supports you and who can you talk to? And sometimes, if especially, in terms of burnout, if it's people we work with or people that supervise us, we need to find another place to maybe vent or have some support. So who does support you? Sometimes it can't be the same person in the house. Some people say my spouse, but if their spouse and them are sort of, tense with each other, that can't be the person. So where are those other supports? There's a lot of support groups popping up online, on Facebook, that people are responding to, and what activities revive you? What charges your battery? I'm always telling people that. What is that thing that charges your battery? If I go do this, I feel better. Ken talked about going for a walk with a dog and being able to clear his head and maybe think about some other things, and again, before COVID, walking the dog wasn't like the best activity. There were other activities that filled that time, but now it is. We're changing how we're doing things. And again, is it possible to reframe things? Reframing it from, oh my God, this is the most awful thing, to, and some of my teenagers have been really good at this that I see in counseling. One of my teenagers said, one of the good things about COVID is my father used to work in the city and commute. And so we would never get to eat dinner with him. And he would come home late at night after sometimes we were in bed and we didn't get to see him almost until the weekend. And now he's home and we're eating lunch every day together. And it's really been fun. So again, can we reframe some of these things so that they look a little better? Not great, but a little better. Again, are we trying to control something we can't control? It's okay to, say, I am struggling today with anger or grief or frustration or feeling annoyed or feeling like I'm shut in, or watching the news versus, I didn't do a good job today, or I didn't reach out to that student, or I didn't, whenever you're starting sentences with those two words, it's already a place where I call it going down a rabbit hole, not a good place to go.
Right. Speaking about recharging, so think about these things. What happens when you don't charge these up for a while? You go from the green to the red, and then next thing you know, it shuts off on you. So the question would ask is, okay, what percent are you? There was a commercial where they used to show what everybody's percentages was. I think it was like for some energy drink or something. But what percentage are you at? How low is that? Because like the phone, you're at the point, how close are you to that point where you just shut down? And what is that thing you do to recharge to keep yourself well for yourself and for others?
So when we talk about what we can do about it, remembering our worth, and that's really easy to say. And I say that to people and they look at me and their eyes kind of glaze over. But I say, so one of the practices, and I hate to jump on, some of what Ken's going to cover, but, at the end of the day, what did I do that was really good? Or what did I say to a child? Or what happened that, maybe a child laughed when I said something, or, just simple things about what was good that I did, and sometimes I tell people to do the sticky job, put what you did on a sticky and hang it on your bathroom mirror so you see it every day. So we remember that we're worthwhile, and again, having perspective. We are sort of, like Ken said, in survival mode. So we need to acknowledge that we're surviving some things, but we can also maybe thrive in some other areas. And we're going to talk about that as well. Where do I belong? We've lost a lot of those communities that we were able to participate in. So we have to figure out how to do those in a different way. Maybe we have a Zoom call with family, or maybe we, have a 3-way telephone call with friends, or maybe we do one of those Netflix movie nights with one of our friends, just so, again, we're connecting, accepting ourselves. That's, again, part of that whole self-compassion thing. And, our support systems, who do we rely on? Sometimes we can't see those people. I have a friend who, because she is a cancer survivor, she can't go out and she doesn't have interaction with people. So it's important for us to have a phone call periodically so we stay connected. Doing something to provide growth for yourself and learning. And for this one, I always tell people, like, go on Pinterest. Everybody knows what Pinterest is. Go on it, look for something that intrigues you and try it. Challenge yourself to do something different. I have teenagers who, they took up knitting. They went on YouTube, they learned how to knit, and they knit scarves for the homeless. And the scarves weren't perfect knitting specimens, but the kids had a really good time. They learned something new, and then they were able to give them to the homeless. So sometimes if we can challenge ourselves and our families and the people around us, it can be a really positive thing.
So some helpful suggestions. I'm a big fan of the self-meeting. There are 2 times where these are helpful, whichever works for you. There's a morning version, which to me starts out with gratitude, the things I'm grateful that I have, and that I know others, don't have or maybe threatened, particularly at this time. And also that in that meeting, setting out what I want to accomplish that day. I usually pick like a list of big 3. Here are the big 3 things I'd like to get done. And maybe it happens and maybe it doesn't, but I'm going to give it my best shot. The other one was one PJ was talking about, the meeting at the end of the day. For those of us that our minds tend to cycle around a bit when we're trying to get to sleep, the idea about what's one good thing that happened to you that day and what's one good thing that you did that day. And on a positive note, I think watching the news or watching TV in general before you go to bed is probably about the worst thing you can do. It's right up there with, bringing the phone to bed and you're going to finish your day like this. No, end it in gratitude. What did you do that was good? And what was something good that happened with you? Talking to your peers, people that are in the same situation you are. Don't suffer alone. There's no situation that's so bad that can't be made worse by feeling like you're going through it alone. Your peers, to even your supervisors where possible. One of the big challenges of this particular crisis for us is how it's reduced our social networks. So how do we push back about that? I have Zoom meetings with my family now, family members that I'm used to seeing. Now we have to struggle to make a Zoom appointment or just catch each other on the phone, but we do it. It's good for our well-being. What support group, as she mentioned before, counselors. And again, speaking about the value that you do, I'm used to working with healthcare workers. So usually I'm saying, hey, look, you care for people. You help with people's, health, their well-being, keeping them here on this planet. And, when we talk with educators, it's working with children. You are the guardians of our future. People entrust their children to you. How much more important do you get than that? I don't know. I don't know how much more important it gets than that. I don't know if you guys get all the credit that you deserve. You probably don't. But it's really critical. Think about the teachers and the people that molded you and shaped you to who you are today. And you stand on their shoulders. And hopefully you're launching that next generation. COVID be damned. You're launching that next generation into the future. And they'll be thinking about you. Those students will be thinking about you at some point, like you think about the people that started you on your journey as well. And that's a beautiful thing. So let's not deny the situation. We had a lot of issues early on where, I don't think COVID was taken as seriously as it could have been, and that didn't help us very much. And of course, that also fits for stress. Denying stress does not help very much. Let's try to look at this objectively. Hopefully you got like a little numeric score, which is a starting point for you today. What are the causes of your symptoms? I'm hoping we've shown a little light on that today, which has to do with the burnout, the organizational aspects of your work stress, the compassion fatigue, the person emotional part of your work stress, your own maybe past traumas and past material coming up again. How do you do that? And mentioned this before, don't change everything at once. Start somewhere small. Start by just rearranging the space that you work in so it works a little better for you. PJ and I have both done that in the course of the last year. We are not working in the same place that we started because we needed a change. We had to move things, even if it was a pain in the butt, moving things around. It just had to happen so we'd be more comfortable and that we would be okay. It was its own form of self-care. So one small thing. And refilling our well. I love the metaphor of the well of compassion. Because of course we're dropping the bucket down and giving water to everybody all day long. And what happens when you send that bucket down and you hear a clunk instead of a splash? It's hit the bottom now because it hasn't had the time that it needs to replenish itself, to recharge and refill. So how do we do it? How do you guys do it? What are the thoughts? What are the feelings? What are the behaviors? What are the daily practices that you have to keep yourself well? As was mentioned early on, I worked in the emergency room for over 20 years. And when we had a really bad day in the emergency room, we were talking about people dying or something really tragic going on, I would go to the beach and it would be the middle of the night, and I would just sit out on the sand. Could have been February, could have been dead of winter, could have been a nice night. And I would just watch the waves come in, and I would just sit and watch them until I felt better. And no idea how long it took or even why it worked. I didn't care. That was something I needed to recharge because I didn't want to go home and try to sleep or just bring that, energy into the house. So what are those things for you? And are you doing them? Or has something gotten in the way of prevented that from happening?
And so some just quick exercises, and this quick exercises workbook, is available, but just some quick tips for using mindfulness at work. And again, I know we sort of use mindfulness as a catch-all phrase and it's been around a lot, but I tell educators, if you can do some of these exercises with your students, they not only help your students, but they help you. And you can teach your students things that will help them to not only self-regulate emotions, but calm themselves down and help themselves. The 5 senses. Okay, everybody for a minute, tell me one thing you see. Tell me one thing you hear. Tell me one thing you taste. Tell me one thing you smell. Tell me one thing you feel. If you can do that with your kids as just an exercise before maybe you start the day, or, do a breathing scan, okay, let's all take a deep breath in. Let's count to 4, let's breathe out. Do that with them a few minutes. Again, it helps everybody to settle down. A body scan, where are you holding tension in your body? We now know that a lot of physical symptoms manifest in our body as a result of mental health issues and stress. So again, where are we holding that and how do we release that? A self-compassion pause, during the day, stop for 2 minutes, look around. How can I be kind to myself in this moment? What do I need? Or, what did I do good? Or, how am I being in the world with my students today? And again, some mindfulness in meetings. We talked about gratitude in the evening and a morning meeting. Those are some real quick tips. And you can give those to your kids, when they come in the morning. Okay, everybody tell me something that you're grateful for, or tell me something good that happened yesterday. And again, we can do this with our children and it helps them as well as helping ourselves.
So to wrap some of this up, we have a little more to cover, but to summarize the main points that we've talked about so far. Empathy, not the same thing as compassion. Compassion is specific to shared suffering. Empathy is sharing, any feeling in common with somebody. You probably noticed this in some of the slides, but there were quite a few slides linking compassion to several religious traditions. There was a slide on there of Christianity, Judaism, Islam, and Buddhism. Compassion is a critical piece of many religious traditions as well. Self-compassion, compassion for yourself is critical and necessary. You have to be compassionate and kind to yourself before you can be compassionate and kind to others. There are many things that positively and negatively influence our compassion, but there's also a lot we can do to reduce our own suffering. The first one that jumps out at me that PJ mentioned was the reframing. How we look at something is pretty critical. How we frame it makes a lot of difference. And you'll get a good example of that in about a minute. And those of us who are in the helping professions, we have very specific threats to compassion because we just keep extending ourselves to people and taking on some of what they've got going on. So you carry around a little of that with you everywhere you go, and it's cumulative. So we can, but at the same time, we can also grow from this. The old line, anything that doesn't kill you makes you stronger. There's a degree of strength to that. Like, how, adversity teaches you how strong you are. Good times don't teach you how strong you are. Adversity does that. So we can learn from this and we can come out the other side of this better than we were when we went into it. It's a particularly harsh teacher, but some of the best teachers are, right? So I just wanted to share this story with you, and you may be familiar with it already. And it says that an old man had a habit of taking early morning walks on the beach. One day after a storm, he saw a human figure in the distance moving like a dancer. As he came closer, he saw that it was a young woman. She wasn't dancing, but she was reaching down into the sand, picking up starfish, and very gently throwing them back into the ocean. He said, "Young lady, why are you throwing the starfish into the ocean?" She said, "The sun's up, the tide's going out, and if I don't throw them in, they will die." And he said, but young lady, don't you realize there are miles and miles of beach and starfish all along it? You can't possibly make a difference. The young woman listened politely, paused, then bent down and picked up another starfish and threw it into the sea past the breaking waves. She said, it made a difference for that one. And to me, that's my view of what you guys do, especially in a crisis situation. We're saving the starfish one at a time, but we have to be well to do that also. If we're diminished, then we're not going to be able to do that as well. And any of you don't know what this is, in the aftermath of 9/11, which PJ and I worked on the relief efforts, these were the two lights where the Twin Towers once stood. This is before the Freedom Tower was built. And they kept those lights on for a while, and we could see them from one of the places where we worked. You could see them from the Jersey Shore. And it was a reminder. But one of the things that came out of this time was that people really gained a lot of respect for firefighters, police officers, Coast Guard, all sorts of people who helped and responded and stepped up. In fact, in New Jersey, one of the biggest helpers were people who owned chartered fishing boats, who went over to New York and got everybody and got them out of there. So those people, I think we rediscovered that we'd taken some of those people for granted. And then in a crisis, you really saw how they stepped up. And one of the things I think we're learning now through this is the importance of healthcare workers, of first responders, and of teachers who are responsible for, continuing to keep education going, even under the worst of circumstances, which is where we are now. So that's one of my hopes, is that has sort of rekindled that respect for the profession that maybe people weren't 100% appreciative of before.
And Ken, we don't want to leave out the counselors and the psychologists and all those other people who
100%.
aren't necessarily teachers in the school system, because you're included in that group.
Oh, absolutely. You're all part of the team, and everybody's a vital part of that team. And when we worked in the emergency rooms, there were positions that we didn't realize how important they were. But then when you need them and they show up and they're there, it's really vital. That's a great point.
And so our closing thought is a quote from Viktor Frankl, who wrote the book Man's Search for Meaning. And if you don't know who Viktor Frankl was, he was in the concentration camps, and he was a man who wrote a book about how he did not lose his hope, despite the fact that he was in those awful conditions. And the thought is, what is to give light must endure burning. Again, you as people in the school system give a lot of light. And so our warning is that those of us who gives ourselves in service to others are going to burn. It is inevitable. There is no way to witness pain and suffering in others without it also causing us pain. But the prescription is that we grow the capacity to tolerate and even embrace the pain of our work instead of fighting it. And we begin to find beauty, indomitability, and heroism in clients and in ourselves. And again, we are heroes, you are heroes. So again, don't lose that piece that you have that recognizes that you are a hero, and you have to be kind to that hero in yourself.
Mm-hmm.
So our references are there. We're now going to take some questions and answers if anybody has any comments. In the meantime, that is our QR code. You can hover over that with your phone, and that gives you a brief survey about today's training. And again, our SAMHSA funding is directly tied to our training, so that when you fill out those surveys, that allows us to provide all of this training free of charge. So I'm going to open it up now to see if we have any comments or questions that anybody wants to make as we close. You know that we're a little early. We're going to get you out of here a little bit earlier than 5. So
feel free. We'd love to have questions. You can either put them in the chat or the the Q&A part.
Also, we have a very small group, and if anybody would like to speak, you can raise your hand and I can enable you to speak.
Oh, great. Yeah.
Yes, we have a very small group.
Yeah, you could raise your hand, and that way you can ask your question directly. Be nice to hear from y'all as well.
And Ken and I will put our emails in the chat box in case any of you are a little shy and don't want to raise your hand or unmute or ask a question while we're here, but certainly if you want to reach out to us later, we will be more than responsive in answering any questions or, you know, the suggestions that you may have about today's material.
Sure. And if you want the PSCI sent to you, we can do that as well, or any of the other materials that we talked about. If you have trouble with the link or anything like that, we can email that stuff directly to you.
So I don't see any comments or questions in the chat.
No, PJ, we don't have any questions. So again, the QR code that you see on the screen is our survey link. We will be posting a web recording as well as the presenter slides to our website. And I will also send all the participants a link to that so that you can have it and refer to it as needed. Like PJ said, these trainings are at no cost to you and we're federally funded, but we also require an evaluation component and these surveys are closely tied to that. So we thank you in advance for your participation. So if there are no questions and I didn't receive any in the Q&A or in the chat, I thank you again for coming. Thank you, PJ. Thank you, Ken. And do you have any final comments for our group?
No, just to please take care of yourselves and, honor yourselves as the heroes that you are.
Thank you. Absolutely. And we hope you continue to stay safe and well. And please feel free to reach out to us if you have any questions. Thank you all. Take care.
Take care.
Bye.
Bye. PJ, I think Ken has to either end the meeting.
Oh.
I don't think he knew that.
Yeah.
I texted him, but